Hi, Dave with Align Therapy here. Today I'm going to talk about if you're a pediatrician, or let's say you're a patient that has seen a pediatrician, when should a pediatrician refer for scoliosis specific exercise? It's a common question that I get with pediatricians that I talk to. Some of them are specific in what degree they refer and things like that. But let's talk about what to look for. It's not as cut and dry as at 20 degrees you refer to scoliosis specific exercise, because there's some other things that we need to think about. So let's just talk about it a little bit. So classic scenario is a patient goes into, this isn't the start of a joke, but a patient goes into a pediatric office for their wellness check, and the pediatrician will have them bend forward like this and touch their toes, and then they'll look down the back and see if one side is higher than the other. It's called an Adams test. So if they see that there's a prominence or a difference in the height of the back, then they will, well, that's when they have to decide what to do. Most of the time I usually suggest getting an x-ray done to see if there's a scoliosis curve. If you see a rotation, especially a significant rotation, we use a scoliometer, and if there's a greater than 3 or 5 degree scoliometer reading, then I really suggest doing an x-ray. But then you do an x-ray and you see what degree the curve is. And depending on what degree that curve is, that should trigger one thing or another. So we have to factor in a few different things with this. So the first thing is the age of the patient. So if someone is really young, then I would definitely recommend referring sooner and not waiting for that referral. So if the patient is young, then referring earlier or faster. If it's an older patient, so if you're in a pediatric office and it's an 18-year-old that you're seeing a positive Adams test and you get an x-ray and there's a 15-degree curve, they're probably done growing, not as big of a deal. So we have to consider the age. That helps us to determine whether or not it's something that we should be referring for. So I'm going to put here size. So the size of the curve. Obviously smaller curves are less urgent and less likely to need intervention, but the bigger the curve, the more you should be referring for scoliosis specific exercise. So usually if it's less than 15 degrees, that's where we could kind of wait and see if it's getting worse. The only time less than 15 degrees that I would really recommend referring are two scenarios. One if they have pain, or one if they're younger. Like if it's a 9-year-old with a 15-degree scoliosis, they have a lot of time to grow. We should probably start intervening with that early on. So the size, less than 15 degrees. If it's over 15 degrees, more likely that the referral would be appropriate. Definitely as we get into 20, 25, 30 degrees, those are definitely appropriate patients to refer. Again, we have to go back to the age criteria though. If they're older and their growth plates are closed and they have a 20-degree curve, chances are they're probably not going to need intervention, because that curve is most likely going to be stable and stopped. The other thing we have to think about is whether they have pain. So yes or no if they have pain. If a kid has back pain, whether they have scoliosis or not, they could benefit from a scoliosis specific type exercise program, something specific to pediatric back pain. We see a lot of pediatric back pain in my clinic, and it's something that we're very comfortable treating. And so if a patient has had back pain and it's not getting better with just rest or anything like that, then they're definitely a candidate for referral. So pain, that's a good indicator for referral. A curve over 15 degrees, that is also something that can indicate that that's a time to refer. And especially if they're younger, that's also one of those triggers that would be a good referral. So again, we need to think about all of these in conjunction. So if they don't have pain, we're good. If they don't have pain, it doesn't mean we don't refer. I mean, we can have a 45-degree curve that doesn't have pain, and they're still an appropriate referral. Age, if they're older but they're having pain, that's an appropriate referral. If they have a curve less than 15 degrees but they're young, then that's an appropriate referral as well. Here at Align Therapy, we can do a free consultation where we can talk to the patients about what can be done and where they are along this spectrum and what their risk of progression is. And so that can definitely be utilized. If you're a pediatrician and you're wondering if a patient is appropriate for referral for scoliosis specific exercise, then have them come in for a free consultation. We'll talk to them about if they're appropriate or not. I don't like to over-treat patients. I also don't like to under-treat patients, so we try and do what's appropriate for them. So keeping in mind the pain aspect, how big their curve is, and what their age is. Not every curve that's over 20 degrees needs to go to Primary Children's Hospital. If they're older and it's not progressive, that maybe let's not make that referral. But if they're having pain, I think a referral for scoliosis specific exercise in conjunction with the referral to Primary Children's is appropriate. So hopefully if you're a pediatrician and you're seeing this, it helps to kind of think through that process. If you're a patient or a parent who has been in the doctor's office and your kid has been diagnosed with scoliosis, hopefully this helps you to know if your child or you are appropriate to come in for scoliosis specific exercise. To learn more about what we do for scoliosis specific exercise with the Schroth method and the SEAS approach, you can check out our website. You can also subscribe to the channel and watch some of the other videos that we have. And hopefully this video was helpful, and we'll see you next time.